Towards integration of primary healthcare, development of core syllabi integrating primary healthcare for basic medical education. Ayan po ang title ng Faculty Development Program na ito, organized by the Association of Philippine Medical Colleges in cooperation with us, the Philippine Academic Society of Community Medicine, or PASCOM. It was around maybe 8 months ago when we, the executive officers of PASCOM, had our courtesy call to our APMC president, Madeline Sosa, who then just started her term. And if I recall correctly, in that very first meeting with her, she shared her plans for her term, including the creation of a primary healthcare core syllabus, and possibly tapping PASCOM to help in the endeavor. From then on, we jumped into preparing for the CPD program. And after at least 6 meetings of the EXICOM officers and around 4 meetings with the APMC, including its curriculum committee, we got an approval for the design of this program. However, our work in making proposed syllabi for primary healthcare didn't just begin 8 months ago. I think as far back when I was treasurer of the organization around 5 or 6 years ago, most of our meetings have been devoted to discussing primary healthcare and incorporating its principles in our conventions. Maybe one of the major milestones we had was the creation of the 6 pillars of the primary healthcare practitioner during our 2017 General Assembly at the UERM. From then on, our conferences have been themed under the 6 pillars of primary healthcare, starting with the right to health during our 2019 General Assembly in UP Manila and the Community Medicine Orientation course in November 2019 at the PMA Auditorium. In that 6 pillars, we proposed that the PHC, or the primary healthcare physician, is a general physician who applies the principles and approach of primary healthcare under the Alma Ata Declaration of 1978. And these outcomes of the PHC practitioner include: 1, upholds the right to health and works towards its realization. 2, addresses the social determinants of health through intersectoral collaboration. 3, advocates for primary healthcare approach. 4, guarantees genuine community participation in all levels of intervention. 5, utilizes the health systems approach. And 6, provides quality, comprehensive, primary, and first contact care. Thus, even prior to the mandate of the Universal Healthcare Law to reorient health professional education curriculum towards primary healthcare, we in PASCOM have been eating, digesting, reading primary healthcare for the past several years. And maybe during this entire process of coming up with proposed curriculum or curricula on primary healthcare, I've been reminded of 2 things. 1, academic freedom, and 2, inclusivity. At one point in our journey, we got questioned about coming up with so-called new curricula or outside what was said as previously agreed upon, when it was actually our job as an academic society to come up with syllabi, curricula, and the like. Actually, the original title we proposed for this program was Towards Reorientation to Primary Healthcare. But we were reminded about the academic freedom of medical schools and institutions to decide on what they will teach and how they will teach primary healthcare. Thus, after you as participants come up with model syllabi in this course, you can still improve them and decide how you will teach them when you go back to your respective medical schools. Again, academic freedom. So who would now teach primary healthcare? This leads me to the other term, which is inclusivity. We know that the task of teaching primary healthcare has always been delegated to the community medicine faculty. But we in PASCOM believe that primary healthcare should be known, taught, and hopefully be practiced by any physician, regardless of field or specialty, and whether generalist or super specialist. Because if our students or our learners see that even basic medical science teachers, clinical instructors, again, regardless of specialty, know and can teach the principles of primary healthcare, then maybe, and hopefully, they will learn and embrace primary healthcare better. Later, we hope to go beyond physicians to include collaboration with nurses, midwives, barangay health workers, and other members of the healthcare team. Inclusiveness, inclusivity. And again, we hope that you can always keep these two things in mind as you go through the program: academic freedom, inclusivity. On behalf of PASCOM, I would like to thank the APMC through its president, Dean Madeline Sosa, its national director, Dr. Ramon Arcadio, and the chair of its curriculum committee, Dr. Remedios D. Chan, for the opportunity and support in this project. Special shout out to Ma'am Richie and to Ma'am Jel of the APMC Secretariat for all their assistance. We would also like to give our special thanks to the University of the East Ramon Magsaysay Memorial Medical Center to its Dean, Norbert Nailing Uy, College Secretary Dr. Vina Quinones, and the Chair of the Department of Preventive Community Medicine, Dr. June Season, for providing us with a venue for the program. UERM is the first home of PASCOM, and having UERM as our Zoom host for this meeting feels like being back home. Maraming salamat po sa inyo. Finally, thank you to the deans of the medical schools for sending in your representatives, and also, of course, the faculty participants who signed up. I hope that we'll arrive at enriching outputs at the end of this 3 days program. Maybe I would like to end you by asking your question. Ano ba talaga ang primary healthcare? What comes to mind when we say primary healthcare? Paki-post lang po ang inyong sagot sa ating chat box, ang attendance na rin, and mamaya usap pa tayo. Again, what comes to mind or top of mind when you hear the term primary healthcare? Muli, ito po si Dr. Cherry Bernardo-Lazaro, ang inyong PASCOM President. Bumabati sa inyo ng belated Happy Easter at maligayang Pasko.